Hello, my name is Joanna Velasquez, and today we'll be talking about Hirschsprung's disease. Hirschsprung's disease is a condition in which nerve cells are missing in part or all of a person's bowels. Typically, nerve cells run along the entire bowel system and allow stool to move throughout the large and small intestine. The disease starts since birth, during the gestation period in which the nerves of the colon of the fetus falter at some point, resulting in a lack of nerves. The disease is easily detected at birth. This would be because the symptoms are easily identifiable. If the newborn fails to defecate in the first 24 hours, that is the first warning sign. After 48 hours, the child will be diagnosed with the disease. Vomiting, a bloated stomach, bad eating styles, and unhealthy weight gain are part of the symptoms. Thanks to the medical advancements we have today, there is a procedure called the transanal endorectal pull-through that is a cure for Hirschsprung's disease. What this procedure does is it eliminates the area in which no nerves are present and connects the loose end to the anus. Most patients can live a normal life after this, but there are other syndromes, most commonly Down syndromes, where there is a high possibility of the child having complications after the surgery. Most of these complications include bowel obstruction, chronic constipation, and the likelihood of getting enterocolitis. Enterocolitis is caused by a large presence of bacterial overgrowth. If left untreated, enterocolitis can be dangerous, even fatal. After surgery, it is highly recommended to record any symptoms that occur when different foods are tried. A high-fiber diet is also really helpful to reduce the chances of constipation. Constipation after the surgery can lead to enterocolitis, which is very dangerous. The most affected are children. This would be because this is a condition that starts from birth. Some adults might present symptoms and might be diagnosed with the disease so late in their lives because it was not as pronounced, but they should have had it since birth. It is still unknown how the Hirschsprung's disease occurs, because there is no pattern, except that there is a high possibility of it being present in the second child, or if you have suffered from the disease, you might pass it down to your children. Since there is no way of knowing if the child is going to be born with the disease, it is hard to take preventive measures. The only known correlation would be that if the child has Down syndrome, the probability of the child to be diagnosed with Hirschsprung's disease is higher. The disease can be diagnosed through the symptoms or through a rectal biopsy. Mostly children who suffer from this condition tend to have explosive diarrhea right after the biopsy. The biopsy tests for the presence of ganglion cells. If they are missing and the presence of hypertrophic nerve trunks is detected, then the diagnosis would be Hirschsprung's disease. With social media allowing the whole world to share and learn about their experiences, it is easy to find a support group for Hirschsprung's disease. The most notable and easiest to find would be REACH. REACH was founded by Shanedig after their son Adrian was diagnosed with total colonic Hirschsprung's disease. The group provides guidance to families with children with the disease by other families that have been in the same situation. Most of the board members are also closely related to the subject, some of which are doctors and others because they are parents of a child with Hirschsprung's disease. With their knowledge, they provide help to others who might need it. Hirschsprung's is a congenital disease, meaning it is acquired from birth. It is easily treated from a young age, and after which they can live a normal life. There are few complications that might happen after the surgery, but maintaining a healthy diet that does not lead to constipation will result in a healthy and normal lifestyle.